Hello, I'm Teresa Spearing and welcome back to Number One Health. Once again we're here with Dr. Charlie Eastman.
Hi, Teresa.
And Charlie, I want to speak to you about travel health.
Thank you.
So why should I bother to see a travel health specialist? Why is that important?
Yeah, if you go abroad, then you expose yourself to more diseases, that's the first thing. And so there are vaccines that can protect you against those things. You also may need advice about the sexual health side, and it's really crucial for people to make sure they've got the right insurance to cover their trip abroad as well.
Right. And what are the basics that I need to know about travelling outside of Europe, the USA and Australia? Tropical diseases,
Absolutely,
things like that.
yeah. I'm going to speak a bit against ourselves here because the first thing you must do is get insurance. Because if you get ill or there's a road accident and you need to be medevaced back, it would cost you the mortgage of your house just to get you back to England.
Is it that expensive?
It can be really expensive. And I used to do medical evacuations, and I've dealt with people who weren't insured, and it was 40, 50, 60,000 pounds just to get back to the UK, let alone hospital costs. So first thing, make sure you've got insurance. Second thing is seek advice about the basic vaccinations that you might need. And also, if you're going to someone with malaria potential, then get advice about what antimalarials to get. And there are other diseases that we can't vaccinate against, there's no tablets against, but you can protect your skin against, and that's things like dengue fever, which can be a really nasty viral illness.
Right, okay. And what is the minimum set of vaccines that I should consider?
Yeah, I think if you're going outside of Europe and America and Australia, I would certainly think hepatitis A, because hepatitis just means inflammation of the liver. It's a disease that can make you ill for about 6 months. You go jaundice, so you'd end up with yellow eyeballs, which you're a very pretty lady wouldn't see, you'd have yellow eyeballs. And so it makes you really ill. And we can vaccinate against that. We can also vaccinate against typhoid, which is another illness that in the worst case can cause perforation of the gut. And some people have died from that perforation of the gut. Fortunately, those two come as a combination. Everyone should be up to date with 3 things called diphtheria, tetanus and polio.
Right.
Fortunately, they come as one vaccine. So I would say Hep A and typhoid, diphtheria, tetanus and polio would be my recommended minimum.
So that's only 2 shots, really?
Absolutely. So
great. And should I be concerned about accidents abroad?
Very much so. There's an organisation that studies this, and the statistics are really very frightening. And if you look at any paper, there's always a story about a gap year student or group of friends who do things like they're in Kenya on a matatu or whatever, and they fall off and accidents happen. So really, people need to be aware of that. And often people end up driving in a country, for example, where it's the wrong side of the road, the wheels are wrong side, they're tired, and they're not wearing a seatbelt. So inevitably things happen and go wrong.
So it's important to get health insurance always.
Absolutely, and take some level of precaution and not drive when you're too tired, not too tired.
Right, okay. And is my sexual health at risk overseas?
Yeah, the statistics actually are quite scary on this. The Foreign Office itself did a report. Some people think that it was held back a bit, but they did a report. And Brits are great marauders. They love going abroad, they love getting their booze, and frankly, they love getting laid. This is just a fact of life. So we should treat everyone in the same way. That there are some people who are absolutely abstinent, good for them, but the majority of people in a nice environment with a nice bunch of people will absolutely. So the reminders again is about protecting yourself, using condoms and all the rest of it, but also being aware of some of those diseases that can be transmitted sexually.
And where should I go for good advice on travel health?
Absolutely. Well, travel clinics specialise in it, and some general practices have inbuilt travel clinics, so that's the first thing. And then people like ourselves, we obviously specialise in it as well. So those, I'd say, are your key resources. Sometimes I'm worried if people go to a GP who doesn't have a travel clinic, because that person may not have the level of experience as the ones who run travel clinics or the specialists have.
Right, thank you very much. It's very helpful. So if you'd like any advice on travel health, you can also contact Charlie at www.numberonehealth.co.uk.
Thanks, Teresa. And also, we do produce some leaflets that people can download. This one is on children's vaccinations and health. Also, it's got some information on malaria. And this is a general travel health guide, which are both available from our website. Thank you.